Muscle review for practical exam. Muscles of facial expression. The frontal belly of the occipital frontalis. This functions to draw the scalp anteriorly, raise the eyebrows, and wrinkle the skin of the forehead horizontally as a look of surprise. The corrugator supercilii. Its function is to draw the eyebrows inferiorly and wrinkle the skin of the forehead vertically, as in frowning. The orbicularis oculi. The function of the orbicularis oculi is to close the eye. The orbicularis oris. Its action closes the lips, protrudes lips as in a kiss, and shapes the lips during speech. The Zygomaticus major muscle. This draws the angle of the mouth superiorly and laterally, as in smiling. The Buckinator. This muscle compresses the cheek as in blowing, sucking, or whistling, and assists in mastication. The Risorius. The Risorius draws the angle of the mouth laterally, as in grimacing. The Mentalis. The mentalis elevates the lower lip, protrudes the lower lip, and pulls the chin's skin into a pout. Depressor anguli oris. This muscle draws the angle of the mouth laterally and inferiorly, as in opening the mouth. The masseter. The masseter elevates the mandible, as in closing the mouth. Its point of origin is the maxilla and the zygomatic arch. Its point of insertion is the angle and ramus of the mandible. The platysma. This draws the lower lip inferiorly and posteriorly. Muscles that move the head. The sternocleidomastoid muscle, or SCM muscle. This is responsible for flexion and rotation of the head. Its origin is the sternum and the clavicle. Its point of insertion is the mastoid process of the temporal bone and the occipital bone. Muscles acting on the abdominal wall, causing movement of the vertebral column. The rectus abdominis. This provides compression and flexion of the abdominal area. Its origin is the pubic crest and pubic symphysis. Its point of insertion are the costal cartilages of ribs 5 through 7 and the xiphoid process of the sternum. The external oblique. Its action is compression and flexion of the abdominal area. The internal oblique muscles. The internal oblique muscles are responsible for compression and flexion of the abdominal area. The transverse abdominis functions in compression and flexion of the abdominal area. Muscle of the pelvic floor. Pubococcygeus. This muscle supports and maintains position of pelvic viscera and resists intra-abdominal pressure. Muscles that move the scapula and humerus at the shoulder joint. The serratus anterior. The trapezius. This functions in elevation, adduction, and depression of the scapula. Its point of origin is the occipital bone, the spines of the 7 cervical vertebrae, and all thoracic vertebrae. The points of insertion for this muscle are the clavicle, acromion, and spine of the scapula. The deltoid. The deltoid is responsible for abduction, flexion, extension, medial or internal rotation, and lateral or external rotation of the arm at the shoulder joint. The origins are the acromion process and the spine of the scapula, and the clavicle. The point of insertion is the deltoid tuberosity of the humerus, the pectoralis major muscle. Its action is adduction and medial or internal rotation of the arm at the shoulder joint. Points of origin are the clavicle, the sternum, and the costal cartilages of ribs 2 through 6. Points of insertion are the greater tubercle and the intertubercular sulcus of the humerus, the Pectoralis Minor. This muscle performs abduction and downward rotation of the scapula. Its origin are ribs 3 through 5, and its point of insertion is the coracoid process of the scapula, the Latissimus dorsi muscle. This muscle performs extension, adduction, and medial or internal rotation of the arm at the shoulder joint. Points of origin are the lumbar and lower thoracic vertebrae, along with the crest of the sacrum and the ilium. Its point of insertion is the intertubercular sulcus of the humerus, the teres major. The rotator cuff muscles include the subscapularis, Supraspinatus, Infraspinatus, and Teres Minor. The subscapularis performs medial or internal rotation of the arm at the shoulder joint. The origin is the subscapular fossa of the scapula. Its point of insertion is the lesser tubercle of the humerus, the Supraspinatus. This performs abduction of the arm at the shoulder joint. Its origin is the supraspinous fossa of the scapula, and its point of insertion is the greater tubercle of the humerus, the Infraspinatus. This muscle performs lateral or external rotation of the arm at the shoulder joint. Its origin is the infraspinous fossa of the scapula. Its point of insertion is the greater tubercle of the humerus, the Teres Minor. The Teres Minor performs lateral or external rotation and extension of the arm at the shoulder joint. Its origin is the inferior lateral border of the scapula, and its insertion is the greater tubercle of the humerus. Muscles that move the forearm at the elbow joint, the Brachialis. The brachialis performs flexion of the forearm at the elbow joint. The brachioradialis muscle. This muscle performs flexion of the forearm at the elbow joint, along with supination and pronation of the forearm. The Biceps Brachii. The Biceps Brachii perform the flexion of the arm at the shoulder joint and the flexion and supination of the forearm at the elbow joint. The point of insertion of the long head is the supraglenoid tubercle of the scapula. The short head originates at the coracoid process of the scapula. The insertion point for both the long and short head of the biceps brachii muscle is the radial tuberosity of the radius. Triceps brachii. Triceps brachii's action is extension of the arm at the shoulder joint and extension of the forearm at the elbow joint. The origin of the long head is the infraglenoidal tubercle of the scapula. The medial and lateral heads originate at the humerus. The point of insertion for all three heads of the triceps brachii muscle is the olecranon of the ulna. Muscles that move the wrist, hands, and fingers. The wrist flexors include the flexor carpi ulnaris, the flexor digitorum superficialis, the palmaris longus, and the flexor carpi radialis. The flexor carpi ulnaris. The flexor digitorum superficialis. The palmaris longus. Its action is the weak flexion of the hand at the wrist joint. The flexor carpi radialis. Its action is the flexion and abduction of the hand, or radial deviation, at the wrist joint. The wrist extensors include the extensor carpi radialis longus, the extensor digitorum, and the extensor carpi ulnaris. The extensor carpi radialis longus. The extensor digitorum. This performs extension of the phalanges and of the hand at the wrist joint. The extensor carpi ulnaris. Its action is extension and adduction of the hand, or ulnar deviation, at the wrist joint. Muscles that move the femur at the hip joint, or the leg at the knee joint. The Gluteus Maximus. The action is extension and lateral or external rotation of the thigh at the hip joint. Its origin is the iliac crest, the sacrum, and the coccyx. The points of insertion are the linea aspera and the gluteal tuberosity of the femur. The Gluteus Medius. Its action is abduction and medial or internal rotation of the thigh at the hip joint. It originates at the ilium and inserts at the greater trochanter of the femur. Tensor fascia latae. Its action is flexion and abduction of the thigh at the hip joint. The Sartorius. The action is flexion, abduction, and lateral or external rotation of the thigh at the hip joint. The iliopsoas. This muscle performs flexion and lateral or external rotation of the thigh at the hip joint. The Gracilis muscle. This performs adduction and medial or internal rotation of the thigh at the hip joint and flexion of the leg at the knee joint. The leg adductors are the Adductor Longus and Adductor Magnus. The Adductor Longus The action is adduction and rotation of the thigh at the hip joint. The Adductor Magnus This performs flexion, extension, adduction, and rotation of the thigh at the hip joint. The Quadriceps femoris muscle includes the rectus femoris, vastus lateralis, vastus intermedius, and the vastus medialis. The rectus femoris Its action is flexion of the thigh at the hip joint and extension of the leg at the knee joint. The vastus lateralis This performs extension of the leg at the knee joint. The vastus intermedius Its action is the extension of the leg at the knee joint. The vastus medialis Its action is the extension of the leg at the knee joint. The hamstring muscles include the semimembranosus, semitendinosus, and biceps femoris. The semimembranosus muscle This performs extension of the thigh at the hip joint and flexion of the leg at the knee joint. The semitendinosus Its action is the extension of the thigh at the hip joint and flexion of the leg at the knee joint. The biceps femoris This muscle provides extension of the thigh at the hip joint and flexion of the leg at the knee joint. Muscles that move the foot at the ankle joint and toes. The tibialis anterior This muscle performs dorsiflexion and inversion of the foot at the ankle joint. The extensor digitorum longus The fibularis longus or peroneus muscle. The extensor hallucis longus. The gastrocnemius muscle. Its action is flexion of the leg at the knee joint. The soleus This provides plantar flexion of the foot at the ankle joint. The flexor hallucis longus. Thank you for watching.